Welcome everyone to this exciting mini-series on our Collaborative Partners forums. I think it's the second in a row of mini-series, and a bit of a new way we are trying to educate each other and inform on activities that are going on in our region. I'm Sabina Moosman. I'm CEO of the Pembroke Regional Hospital. I'm also the co-chair of the Ottawa Valley Ontario Health Team Steering Committee. So maybe we'll start with the land acknowledgement and then introduce the series. So we, the Ottawa Valley Ontario Health Team, will begin this Collaborative Partners Forum by acknowledging that we're meeting on the Aboriginal land that has been inhabited by Indigenous peoples from the beginning. As settlers, we are grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. Long before today, as we gather here, there have been Aboriginal peoples who have been the stewards of this land. In particular, we acknowledge the traditional territory of the Algonquin and the Anishinaabe. We recognize and deeply appreciate their historic connection to this land. We also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made, both in shaping and strengthening this community in particular, as well as our province and country as a whole. As settlers, this recognition of the contributions and historical significance of Indigenous peoples must also be clearly and overtly connected to our collective commitment to make the promise and the challenge of truth and reconciliation real in our communities, and in particular to bring justice to missing and murdered Indigenous women and girls across our country. So, thank you for coming today and attending. And just to introduce the session a bit is we have 33 lead agencies in Ontario. I just learned this yesterday from Sue Kennedy, who coordinate youth and children's mental health services across Ontario. And the Pheonix Centre is the lead agency for Renfrew County. They have been long committed, and we have been working with them for many, many years on working with local partners, youth and families to identify and meet the needs of children and youth and families close to home. Just recently, over the last few months, all of the youth, families, care providers, and service partners came together, shared their experience, expertise, and made some recommendations on priorities to improve the healthcare in our region. Today, they will share an overview of the 24-27 plan that was developed from these conversations. We're going to hear from partners that have been involved and engage in open discussions on the next steps. So I think this is going to be a very interesting next hour, and I'm really happy that all of you could join us. And I think I'm handing it over to Sue for the first segment of this session.
Thank you. I think to Emma, actually, right, Emma?
That's right. Thank you so much. Okay. I'll take the first, and then we'll move to Sue in just a couple of slides.
But thank you, Sabina, for the introduction. And many of you around this call this morning were very engaged in the community engagement process. We did a formal engagement process late fall, and many of you participated as late and up to including mid-December. And just to provide some context, as Sabina said, we are part of a 33 lead agency consortium across the province, and each of us in our role and responsibility needed to develop a community service plan at the local level. And so that's why it was so important to have your input and to include your recommendations in our plan moving forward. That being said, we know it's an iterative plan, and we will continue. Our commitment is to continue high level of engagement with families, caregivers, and of course, our partner service providers.
Wonderful. Thank you so much, Sue, and thank you so much for that introduction, Sabina. That was wonderful to set the stage, and we'll just move into just a little bit more background for anybody for whom the child and youth mental health landscape is not as familiar. So just to give you this bit of an overview that comes from the Right Time, Right Care report from the Knowledge Institute, who has made this lovely graphic, which really helps to depict the child and youth mental health sector and how it moves across many different service providers and sectors in our community. The first here, obviously being school-based mental health, a lot of the resources and supports children and youth first get will be in the school, including able to access brief services in their schools. As they may move up the spectrum of need with greater severity and greater need for more services and supports, they'll move into community care, up to and including intensive care services, which may be day treatment classroom services, they may be in-home services or live-in treatment. So there's a number of providers who come together to provide the support for children and youth mental health in our community. And many of them are funded by different ministries. One of the areas that partners are seeing a lot of hope and reason for opportunity and movement in this area is that many of these ministries are coming together with a clear, aligned vision for how to provide these services in a really unified way. So we're really hopeful that that some of these initiatives and this plan will resonate with many of you. This is just to give you a very, very brief snapshot of child and youth mental health in Renfrew County. There's much we could share here, but just to give you a little bit of information, the Early Development Instrument, which is conducted every 2 years among kindergarten students in Ontario, gives us a bit of an idea of the needs at this early stage. 6% from Renfrew County identifying with special needs at this age, 3% with multiple challenges. We also see a relatively high percentage of children with needs related to language. This may be because English or French is not their first language, but sometimes it's just that their language skills are not yet at what they need to engage in the classroom in the way they would like to be engaged. We also see that the vulnerability in more than one domain measured on this early developmental instrument is at about 29%, at least one domain is identified as a vulnerability among students. You can see some context here in this map of Ontario where Renfrew County is pointed out here. So we compare relatively well among many of our neighboring counties as well. One of the things that we're looking to is the next cycle of this. We know that development for children has been impacted by the pandemic in recent years. This cycle that's represented here does not yet capture that. So we're looking to the 5th cycle to really start to see some of those impacts that we know we're hearing from families, from children, youth, and from partners and providers. A little bit of the information we have about the 2023 data will not come as a surprise to many of you, that the most common presenting issues are anxiety, mood, and behavioral disorders, as measured through our regional system navigator, One Call, One Click, who is able to share this data specifically for Renfrew County with us. We also are seeing some really positive data based on the work that the partners have already been doing to provide more care, as much care as we can in Renfrew County, and prevent children who need to seek emergency mental health visits at CHEO. So we did see that these visits peaked in 2019 and are currently at their lowest level since 2012. One of the interpretations of this is much of the work that the providers and partners have been doing in the county is to get the care to the children before they may need to seek that emergency care outside. So as we know, data is only one area where we can look to for information about the needs for child and youth mental health care. Most importantly, we look to partners, providers, children, youth, and families for information about what the needs are and what the supports and services should be prioritized for our region. As Sue mentioned, and as Sabina mentioned, there's been a lot of consultation. We're very, very grateful for all the partners and youth and families who came together to provide us with the information we need to develop this plan. As mentioned, the Ministry of Health requires this plan every 3 years. And the last plan in 2023 identified 3 areas of priorities for the community. That was integrated crisis systems in all hospitals. This one, we heard from partners and the community that this is working well. So this is in a stage where we feel as though it's gone well, and the processes that are in place are meeting the needs that were identified at that time. The second one, improving warm handover systems in Renfrew County, is probably familiar to many people in different sectors. This is something we've all been working on. And again, some great improvements done in this area. And we just heard from providers and families that we can continue to build on the successes that have already come from this work. The primary care and community mental health pathways and protocols was also identified in the previous iteration of this plan. And we understand that a lot of work has gone into this, and then we still have areas again to build. So we'll continue to keep this one in the plan going forward into 2027. The 2023 consultation did, as we've mentioned, benefit from a number of partners, service providers, tables, youth, parents, caregivers, and families coming together to provide us with the information we needed to develop this plan. The hope going forward is that this will be an ongoing process, that we'll be able to establish steering committees of partners to be able to inform and oversee this work, and that youth and families will have the opportunity to engage in a youth and family advisories to be able to continue to oversee and inform this work as well. So as mentioned, the lead agency for Child and Youth Mental Health County submitted the new multi-year plan January 12th, 2024. Just a little bit about what we heard from those consultations. There's much more than we can put into one slide, but just give you a brief overview of some of the information that we heard and we responded to in our plan. From partners, we heard the need to identify and meet the complex and intensive service needs close to home. And this needed some innovation and a lot of collaborations. Many of the needs are increasing in severity and complexity. We heard a need from providers to support providers to deliver that care together with improved communications, clinical and service pathways, and case coordination. We also heard partners emphasize the need to offer client-centered access to safe, appropriate, efficient services by simplifying and aligning processes, tools, and transitions wherever it may be possible. From youth, we heard very, very strongly that they emphasized early education, promotion, and prevention. The earlier those pieces can be provided to students, to children and youth, they felt the greater the impact on reducing risk and mitigating harms later on. They felt mixed experiences similar to providers. They felt some things were working really well with coordinated care and receiving care from multiple providers. They also felt that there were some areas for improvement. So again, really reinforcing what we've heard from providers as well about priorities. They also, like providers, encourage a client-centered approach, the opportunity to build trust and support clients to navigate the services and support options there are. So again, that navigation piece came out from youth as well. From families and caregivers, we heard that they were really interested in increased awareness, education, engagement opportunities, and cultural inclusion for family members in our community. They felt strongly about optimizing the youth hubs and really focusing on wellness. They also, similar to partners, felt that there's a need to create a unified system of care and to fill some of the gaps that they'd seen. These included severe mental illness, crisis, Indigenous children, supports for Indigenous children, youth, complex needs, rural needs, and housing needs. So from all that information that we received from all these different providers and partners and community members and youth, we put together a plan. It has two pieces. We won't really focus so much on the core provider piece. If anyone's of interest, we can of course share that with you. The more important piece for our community and for all the members who are attending here today is the community aspect of that service action plan. So from that community action plan, there are 3 priorities that were identified. The first being identify complex and intensive service need gaps. So this will involve a review of the services and gaps in complex and intensive care and creating some common definitions so we know we're using the same language in order to identify what the needs are and to be able to fill those needs. Training and capacity building wherever possible, and that will be shared among providers and partners when it's applicable and when it's appropriate and partners are interested. So we'll be sure to communicate that as that develops as well. A process and needs-based criteria for coordinated care for complex and intensive services, and developing a plan to acquire and maintain specialized intensive services in Renfrew County. We'll hear a little bit more about some opportunities that may be on the horizon for that as well. The second priority is to improve collaborative care delivery with an update of the map of child and youth and family services in Renfrew County. And then that will inform a plan developed again with partners. This will all be done with partners for the community plan. Develop a plan to improve case coordination, collaboration, transitions. And we heard that consultations as well was an area many providers felt there could be more movement. And we understand that Kids Come First out of CHEO will be moving. This is not just a Renfrew priority, that this has been heard throughout the region, and they'll be moving some actions forward on improving this system as well as formalizing clinical and system pathways, including for specific populations. So this is one that came out as well, a need to direct clients to the right service and recognizing the intersectional needs they may have and being able to support them in all the ways that they do need. The third priority is review and progress and continue to build primary care pathways and protocols. So this is the one that was carried over from the past plan. We understand that much has been done on this. We'll just review where we are, how providers and partners are feeling about the current process and protocols, and what room there is to continue to improve and grow that. We know already that what we've heard is that two-way communication is one of the priorities for this area. So to better meet the needs of the client, to reduce the need for them to repeat their story, to build safety and to build trust, to better meet the needs of the receiving provider, to begin that care as soon as possible in a safe and appropriate way, and to better meet the needs of the referring provider to offer coordinated and collaborative care and to receive the follow-up they need to engage in that. So that's just a very, very brief overview. And one of the things we're excited about is all the different kinds of supports that we know are coming to be able to support this work, and we won't be alone in this. And I'll pass it now over to Sue to speak a little bit to that. Thank you.
Thank you, Emma. So I think everyone can agree, we have our work cut out for us. And I want to emphasize the we, right? We know that we cannot do this together, and our commitment on the part of Pheonix is to accomplish as much as we possibly can in partnership and true what I would consider working collaboration with each of you. So again, thank you for all of you who participated in the engagement series and have informed our plan moving forward. There are some real specific key initiatives and some lovely pieces of support that will allow Renfrew County to move forward across all of the areas that we've identified that are priorities. So I want to flag for those of you who may not be familiar, we are part of a Kids Come First health team. So the Kids Come First health team has been in existence now for about 3 to 4 years. It is being led by CHIO, and essentially the Kids Come First health team, if we want to think about it as a regional health team, much like our Ontario health teams are. The structure is a little bit different. The funding mechanisms, of course, are a little bit different, but essentially it's all of the child and youth mental health regional providers have come together. The majority of us have signed on as partners. And so one of the key initiatives that was launched about 2.5 years ago now is One Call, One Click. And so right now in existence, it's active, it's live, is a central access, navigation, and service matching system. So that's live. Families, parents can call in, physicians can call in, or it's automated, so you can text, you can call. There's a number of ways to reach out to One Call, One Click, and it's a substantial initiative so that we will have excellent data, which will give us some information about what are the primary presenting issues, not just for Renfrew County, not just for Ottawa, but across our region. What are we seeing? We'll be able to look at the trends, and then ideally that will inform our planning processes moving forward as a region. So we're really quite excited about that. And I really want to give a shout out to CHIO for the leadership on that. That being said, all of the lead agencies across our region, as well as our child and youth mental health core service providers, are participating in this initiative, and a number of you have been involved in early days. And Kids Come First has developed their strategic plan. Our priorities are certainly aligned with those, and that large document is available for you there. And then in addition to that, we have our good friends at the Knowledge Institute for Child and Youth Mental Health and Substance Use. And again, they're situated within CHIO. Some of you have worked with Pranima Sundar and her team, and they're funded directly by the ministry, specifically to support lead agencies and core service providers around evidence-informed decision-making, best practices, and a number of quality standards. And so they exist as a mediary organization, an intermediary organization to support lead agencies and core service providers to implement a number of initiatives. And one of those I want to just flag would be they've released family and youth engagement standards, so quality standards for family and youth engagement, and they have implementation supports to help us implement those kinds of things. So that certainly has been identified as a priority for Renfrew County, and it won't be Pheonix alone having to do that work. Many of you I know have already been involved in that work, and will continue to work with the Knowledge Institute to move that moving forward. In addition to that, they've released a Right Time, Right Care report, and that report was created in combination with the lead agency consortium, so the provincial group, the Knowledge Institute, which happens to be situated at CHIO, but their mandate is provincial, and our friends at School Mental Health Ontario. And those of you who are here from the school boards, you know that's Kathy Short providing leadership. So those three groups came together, and they've brushed off a Right Time, Right Care report, and that really is focused on the collaboration that needs to happen between the school boards and local level at the local level with child and youth mental health services. So that's a recent brushed off report, and my understanding is the Knowledge Institute will be moving forward in the spring to provide implementation supports at the local level. And then most recently, the ministry has announced dedicated funding for intensive services. That announcement is part of the 330 million pediatric investment that was announced last approximately July. And then the most recent announcement, new funding for intensive services at the provincial level funded by the ministry. There is a lead agency working group, and year one of that funding for next year will be focused on live-in treatment. And for those of you who aren't familiar with live-in treatment within the child and youth mental health sector, we have 6 beds at Robert Smart Centre located in Ottawa, and then Youth Services Bureau in Ottawa also provides the live-in treatment beds. It is a gap for Renfrew County. We don't have live-in treatment beds as defined under the Child and Youth Mental Health Act in Renfrew County. So our involvement would certainly be looking at the discharge planning. So for those young people in Renfrew County who are eligible for those beds, what's happening with those children, youth, and families prior to admission. And most certainly we want to be involved in supporting them when they reintegrate into the community. And we'll be doing a lot of that work in partnership with our friends at Family and Children's Services. And then finally, another report. So everyone had lots of weekend reading to do on this long weekend. Again, Knowledge Institute fairly recently created priorities in substance use and addiction services for young people. It was essentially an environmental scan. And out of that report, there have been recommendations that are being moved forward. A couple of funding applications are in circulation as we speak, really wanting to increase the capacity within our child and youth mental health sector in collaboration with our partners to address the needs of children and youth with mental health who are also involved with substance use. And so that will be for sure in partnership with the school boards as well. So those are just 4 sort of major initiatives that are gaining momentum, and we'll be happy to report back to this group as things unfold.
Thank you so much for that, Sue. I know you had an opportunity to speak before, so do let me know if you'd like to speak at this point. Here we'll be hearing from just a few of the partners who are involved and have some things to share on their work and how their work fits in with this plan as well. So Sue, I will pass over to you if you'd like to speak anything at Pheonix anymore.
I just wanted to extend my congratulations for all of the providers, again, who participated in our engagement sessions, but many of you had also been involved and had been very committed to what you would know as the Renfrew County Planning Table. And so that was when we were appointed as a lead agency for Renfrew County several years ago now. And so much has changed. The landscape has really shifted since that time. So the arrival of the OHTs, as an example, which you're all a part of, the investments in School Mental Health Ontario, new investments in mental health supports that are embedded in primary care settings. So the landscape has really shifted. The evolution of Kids Come First in our region. I see all of that as really quite positive, and it really creates a better opportunity for us to look at things like true integrated clinical pathways, possibly integrated clinical services at the local level. So I just wanted to flag sort of the distinction, and then our role will be establishing a working group which will feed up into our existing Ottawa Valley OHT. We're not quite certain of the structure of that, but we're seeing it as a working group focused on child and youth mental health. It would include Pheonix, Family and Children's Services, the school boards, of course, and then there would be a loop up and a loop back down, rather than seeing it as a distinct standalone planning entity. So I'm happy to answer any questions around that. And I know we have good partners, Rebecca and Bonnie, and maybe someone representing Waihu. And if there's not Emma, I can speak to Waihu at the end.
Wonderful. Thank you so much. Yes, Waihu, they did have to send their regrets. So happy to hear from you, Sue. They did send a few things there that we'll update on, and happy to hear from you, Sue, then. So I think we'll pass to Rebecca if Rebecca's online here.
Thank you so much. We're so excited to have this conversation and really looking forward to all the partnering and connections that we're going to be doing. And so just to give you a little background, there was a lovely comic that you brought up. It's not a comic, sorry, it's a model, but it has 2 triangles on it. And so for the school boards, would really fit into the first and second tiers with a little bit in the third. But when we're in the third, you know, those students that really are requiring more support, we're looking to pass those on to community members. And then what we've been asked to augment, which I think is fantastic, is our community connections, so that there's this great pathway to care, through care, and then from care back into the school. And so I'm looking forward to having those conversations, as I know they'll be happening. And something else that maybe is important to highlight for community partners, and that we'll be reaching out for, and we're quite excited for as well, is there's a PPM that's come down for us, and it has 11 different expectations, which we're working through. But another one that applies to community is the need to report on grade 6 students, grade 9 students, and grade 10 students, and their knowledge of where to seek help for mental health. And so hopefully nobody minds if, as we're talking about this integrative approach to care, that we also perhaps tap some supportive providers on the shoulder and say, hey, how can we come together and give that valuable information to our students? And so that's really where we are, and I'll pass it on to Bonnie. If there's any questions, though, please let me know.
And Rebecca, just to add to that, my understanding, and again, there's been, some messaging and circulation. I haven't seen anything formal, but my understanding is that the Knowledge Institute, in combination with School Mental Health Ontario and Children's Mental Health Services, will be supporting some of that work in terms of how to ensure that those collaborative efforts are truly integrated, a little bit different than just referring back and forth. There'll be dedicated pathways. And so I think we're going to, so you and I are tasked with this, but my sense is that we're going to benefit from some implementation support come the spring. So.
Well, and School Mental Health Ontario is one of my favorite things to talk about, actually, because they really do, they're the guiding light, right, when we think about what we're going to do next as a school system. And so they do provide us with our information, and they're really connected. And so on a local level, absolutely. And School Mental Health Ontario, when you've heard from them, you've basically heard exactly what the school boards are going to do next. So, yeah, thank you.
Great. Thanks.
Thank you so much for that, Rebecca and Sue. Really, really exciting news coming out there, and we'll all be interested to hear that. Bonnie, I'll pass it over to you.
Well, I wish I had more than just a few minutes, Emma. I did say that because there's lots I do want to tell everybody about with PLEO. Formerly, it was called Parents Lifeline of Eastern Ontario. Of course, since COVID, things changed. Everything's virtual. We're actually now just PLEO. And I'm a peer supporter. So that means I'm a parent who has a child up to age 25 at the time with any kind of mental health issue. So when when we talk about mental health issues through PLEO, we're talking everything, not just we're talking addictions, we're talking about suicide ideation, gender identity, school refusal, violence in the home from the youth. Drug use is way younger, and there's also mental illness, and there's mental disabilities, right? There's a difference, but we deal with any parent who is supporting a loved one up to age 25 with any kind of mental health issue. So we do this 3 ways. We do it through our phone line, which has been around over 20 years. You can call and talk to a peer parent Monday to Friday, 9 to 7. And from there, if you need more help, you can come to a support group. We have some now back in person. We also have virtual ones. And then our third program that we've been doing Here in Renfrew County, we have our one-on-one program. So if you know a parent or a caregiver of a loved one, like I said, up to age 25, who has any kind of mental health issue and is struggling, maybe the phone line was okay, or maybe they just need to talk to somebody maybe once, or maybe it's ongoing. We will meet the parent where they're at and make a plan. You know, what is your greatest challenge? What is going on? And that's where our partnerships, all of you, come into play, because you're very, very important that we stay abreast of everything going on in the county, because we're not counselors. We're the ones who send them and give them that warm handoff to the resource, whether it's an actual counseling session thing, or whether it's in the right direction to a service or whatever. Really important to know that we are partners with here locally, the Pheonix Centre, Addiction Treatment Services, the YHU, the Renfrew County YHU. We actually have a support group in person that we partner with the Pheonix and ATS there the first Tuesday night of the month. I'd love to tell you more about Pleo. So I put my email up top. So if you have questions about it, I'm actually here right now at the hospital. We have a partnership with the acute mental health department, where we will meet families here, right here on the floor once a month. And if they have, anything that they need to discuss, or we're totally there for them confidentially to support them, whatever it is that they need. And we also sit at the provincial table of the, which is under CAMH, the Youth Wellness Hubs of Ontario. So we sit at that provincial table, which indirectly helps all the local ones with the programming and the things that are going forward. And we're partners with Robbie Dean. And just outside of the county, we are partners with Suicide Prevention, the Royal Youth Services Bureau, and CHEO. And a lot of our referrals do come from One Click, One Call. One thing I just want to put out there is that Pleo is still not well known enough by families who are at home struggling with their loved one. And I really need your support as an Ontario Health Team member to make sure Pleo is on the tip of the tongue of people who are in contact, whether it be teachers, whether it be emergency services people, or whatever. So that is that too much? I can talk longer. But anyhow, yeah, I just really want to make sure everybody knows that Pleo, we are there, been around a long time, and we support families where they're at.
That's wonderful. Thank you so much, Bonnie. And I'm sorry it's not a lot of time. We're really, really grateful you could be here to share what you could with this group. And no, it's just the start of the conversation. Like you said, we really want to make sure this information is available to all the providers here, and even those who may not have been able to attend today. So we'll continue to work with you to make sure that we can communicate that as much as possible. And like you say, reach those who may not be aware of your services and may be isolated at home, struggling on their own. We'd love to reach them. Thank you so much, Bonnie. Sue, I'll just pass over to you if you would like to speak a little bit to the YHU.
Thanks again, Emma. And Allison Green has joined us today from YHU, and so she just sent me a note, and she's going to be able to provide us with a YHU update. So over to you, Allison.
All right. Well, thanks, Sue and Emma and everybody. It's so nice to be here. And to talk about YHU. We're really, really excited at RVH to be able to support the site at Pembroke, and now we're opening up a second site at Renfrew, because as you know, we went out to the youth who would be using YHU before we even opened it and said, where is the place in Renfrew County where we should have this the most? And Pembroke and Renfrew were almost neck and neck, almost exactly the same score. So we opened up in Renfrew. It's been going for just over a year, and we're very grateful to all of you for your support. And we're so excited to be opening up in Mattaway very soon. I believe we get the keys next week, so we're going to be unpacking a lot of boxes. We're open initially at Renfrew 2 days a week, and we've we're fully furnishing the space in the new Mattaway area. And what I think is really special about this partnership with the town of Renfrew is that all the days that Waihu is not active in that space is open for any other community program that supports youth to use. So please reach out to the town if that's a space you want. It will be, again, brand new, fully furnished, a full kitchen, and with all the supports that the Pembroke Waihu will have as well. So that includes peer support, navigation, addiction counselor, and we have a nurse practitioner that's starting in Pembroke, and we're working to get one on site as well in Renfrew. We also, of course, have a van at Waihu. We know transportation is one of the biggest issues that youth have come to us to say is a barrier for them accessing programs. So Waihu does provide transportation to and from our programs for those who aren't able to get there otherwise, or who don't feel comfortable asking a parent for them to come. You can also see we're starting our Strengthening Families for Parents and Youth group again. We're really pleased to be starting that again. We try to have it in different areas of the county every time. And of course, if anybody knows anybody who is interested in participating on our Youth or Family Advisory Committee, we're always looking. So just always thank you for your support, and we're just so excited for this next step.
Allison, I wonder if you don't mind if I put you on the spot. Emma, do we have 2 more minutes before we need to go?
Yes, absolutely. Next is just questions and open discussion. So please go
Yeah, I
ahead.
recognize there's a number of new folk who may not be overly familiar with sort of the purpose or the original model of the Youth Wellness Hub. A little bit different than some of our traditional services, or the way our traditional services for youth had been designed in the past. Allison, are you okay to just touch on that around sort of, I'm thinking about the sort of low barrier. It's intended to be
Sue,
designed a
yeah,
bit differently.
100%. And you know, the analogy I heard, or the story I heard that explains kind of the ethos of Waihu so well is when we speak about transitions, right? And you know, historically for mental health, as we know, and addictions, there's support for children and youth up until, let's say, 17 or 18, and then there's a transition. And you know, you always hear the story of that, you know, 17 or 18-year-old that says, okay, you transitioned out, which is probably okay because, you know, they're at the age where it's no longer appropriate for them to be in a place with littler children. But then they go and they sit in a group class with 45-year-old men, and they go, okay, I'm not sure I fit in here either. And so the reason why Waihu was created in Ontario, and we've had visits from Alberta that's looking to do the same thing, and interest from lots of other regions, is to serve that transition. So we're 12 to 25 years old. To your point, Sue, low barrier. Anybody can walk in off the street and they don't need to do anything. They can come and play Nintendo, because I'm of the age where everything is Nintendo. They can do crafts. They can just sit and do homework. They can come and access food. One thing we've heard is a lot of youth that come in have food insecurity. So we have nourishing, healthy food and snacks available all the time. We have cooking classes. We also have a room in our Pembroke site where you can go shopping. It's all brand new clothes that have been donated to us, feminine hygiene products, purses, shoes, boots, and they can come and just take what they need. We also have a washer and dryer on site where they can come and wash and dry their clothes, and an emergency bed in partnership with Columbus House. So, Sue, you hit the nail on the head. People can come. It's a safe space to just chill. And if they want to access the supports, they're right there. And the only reason we're successful is with the support of all of our partners like you.
Thanks, Allison. And just if others aren't aware, part of the announcement in the fall was flagging there's intention to continue to scale the Youth Wellness Hub model across the province. Each site, of course, looks a little bit different because it's contextualized for local need, but it's continuing to expand and scale.
Wonderful. Thank you all so much. I know we only have a few minutes left. I'll stop sharing my screen to give anybody here who would like to make a comment, pose a question to any of the partners here, or discuss anything that you've heard today. I'll open it up to that. And just while we're waiting for people to raise their hands or take themselves off mute, just to let you know, please do join the next session of this mini series, which will be February 27th at 2 p.m. on the Collaborative Quality Improvement Program. And please do let us know in the chat. There'll be a link to let us know your feedback about what you thought of the session, so we can continue to make sure that these are tailored to what the members need. Thank you so much. So again, I'll pause there. Does anybody have any questions or comments?
Emma, are you going to send out a poll to ensure that all the participants read all of the literature that's going to be attached that we're going to send them?
There will be a quiz. Not seeing any questions. Oh, maybe I'm missing some in the chat. I'll just open up the chat. Rebecca, there's one for you in the chat. I'm not sure if you can see it. You mentioned PPM 11 expectations. Could you please clarify what the PPM refers to?
Absolutely. So there are times where essentially we get very specific expectations that are delivered to us, and then we act on those, of course. And so those are in the form of PPMs. And so at times there are different types of expectations. So for a great example that I think everyone would be aware of is bullying and what's expected to happen around that. And so for mental health, we've just had one. It's one of our first ones, right? And so it's great because it makes sure that everyone in every board is doing the same thing. And so the ones that really apply here really connect to specifically connecting with community partners, especially pathways.
Thank you so much, Rebecca. Sorry, just a clarification. I think they were actually interested in the acronym. Do you know what PPM, could you let us know what PPM stands for?
Oh, that's a great question. That's exactly what we call them. Do you know when you're in one very specific setting, and then that's exactly what it is? But I'll look it up and make sure that I give it exactly, because I'd hate to say the wrong words, right? Of course, it's just so
Rebecca.
so in our language. Yeah.
Sorry, somebody may have it. I think we can all relate to that, Rebecca, and certainly we can see answer. We'll make sure that's provided later. Sorry, did somebody
Let me just ask, the question came from Jade, so I know I can clarify. This is we'll get back to you about the PPM, but it's a directive specifically within the Ministry of Education. So from a mental health sector perspective, we are delighted. So the Ministry of Education has acknowledged that this is a priority, if you will, for all school boards across the province. So we're super excited. In the same way, Jade, that we have directives within our Child and Youth Mental Health Service Accountability Agreement with the province about what our core services need to deliver. So they're quite specific.
Thank you, Sue. I appreciate that. That certainly helps clarify it a little bit more. I know that for many of us that are working either in this sector or across multiple sectors, we often get bogged down in acronyms, and sometimes it might be helpful just to parse through what that specifically means. But in the interim, I'll replace PPM in my mind with a directive. Thank you all. I appreciate it.
Program and policy memorandum.
Wonderful, Rebecca. Thank you. Fantastic.
All right, thank you all so much. If there are no other questions or comments, we are at our time. I'll just pause once more in case people can stay on and have anything else. But otherwise, thank you all again. Please do fill out the evaluation to give us your feedback so we can continue to improve and provide you with what you need. And thank you all again for joining.